how do I use the retinol? How do I, what are the benefits of retinol in the first place? So I just wanted to make you this video of retinol do's and don'ts. Hi everyone, welcome back to Skin Masterclass. I'm Çiğdem Yılmaz, your personal skincare coach, helping you to achieve your perfect skin for education and well-being. Please do not forget to subscribe to my channel. Also follow me on Instagram for daily skincare education videos, and that's at Skin Masterclass. So first of all, what is retinol? Right. Retinol is vitamin A. Essentially, there is lots of different vitamin A derivatives. So there's retinol, the one that we actually find in cosmeceutical products, and probably the most readily available vitamin A derivative out there, which we are using. There is lots of other vitamin A derivatives, which I'm not going to be covering in this video. I'm just literally going to be focusing on what we know as retinol. So firstly, let's start with the benefits of retinol. So retinol is actually a very good ingredient, and it is a scientifically tested ingredient that is able to really help with premature aging, and it's a very good anti-aging ingredient. What I mean by anti-aging is, I don't mean internal aging. That's a natural process and that literally happens to everyone. What I mean by external aging, so any kind of fine lines, it's able to really smooth it out, because what it does, which is great, it increases the cell turnover. So every month we are expected to get a fresh new skin cells on top of the surface of the skin. Again, that also depends on your age, it depends on your skin type, but generally speaking, every 28 to 35 days we are expected to have fresh skin cells on top of the surface. As we age, so as we grow older and wiser, this essentially this process takes longer and longer. And what retinol essentially does, it speeds up the cell rejuvenation process. So it's not an exfoliator. Exfoliator happens essentially there and then. So if you are using a glycolic acid or essentially like a salicylic acid, you're expected to get the dead skin cells sitting on top of the surface almost immediately. Whereas retinol doesn't act like an exfoliator that you'll see the results straight away. It's more of an internal reaction. It speeds up the cell rejuvenation process. It speeds up the whole regeneration of the new skins internally, and then pushes it up on top of the surface. So you'll start seeing benefits of retinol, I'll say, after a good couple of months of using it. So when people say to you, oh my God, start using retinol, you'll see effects of it straight away. That's not true. It does take a good cycle of the skin for you to see that benefit of retinol. Your skin essentially will look much more younger, and it will look much more firmer and more dewy, because you are able to get that healthy living cells on top of your skin. So anything that is healthy and new is able to reflect light evenly. So that's also another important point to point out regarding to why it's so important to have healthy skin cells sitting on top of your surface of the skin, rather than having dead skin cells sitting on top of the surface of the skin, because essentially dead skin does not reflect light, or if it does, it doesn't reflect it evenly. So essentially that's the reason why you start seeing dull skin, and that's the reason why people do have these like grayish appearance on their skin, because their skin is not able to reflect light. And then you become reliant on makeup and illuminators and lots of powders, which is essentially could clog your pores. So rather than relying on external makeup, rely on your natural skin to essentially make your skin look much more glowing and dewy. And once your skin looks much more glowing and dewy, trust me, your skin will look much more younger and much more firm and more plump as well. So you will be definitely surprised with the benefits that you'll see in terms of your glow after you start using retinol. The second benefit is, of course, it helps with hyperpigmentation. So how this happens is essentially you have melanocytes. So melanocytes, again, I'm going to be talking about how our melanocytes varies depending on the skin color and the skin type, but essentially everyone has the same amount of melanocytes. If your skin is able to renew much more quicker, essentially these pigment producing or these melanin producing cells does not have enough time to cause disruption within the area. If you imagine that your skin renews very slowly, you do expect to have some dull skin accumulating on the surface of the skin, right? So this essentially makes your skin look much more grayer. It makes your hyperpigmentation or your melasma appear much more darker than it is. Whereas when your skin is renewed, when your skin is much more new and much more plump, and your skin is like much more glowing, essentially it does not show the hyperpigmentation so readily on your skin. So that's a great benefit of retinol as well. It essentially really helps with hyperpigmentation and reduces the appearance of hyperpigmentation overall. So the third benefit of retinol is that retinol is able to control oil production. So it does generally have more of a drying effect on the skin. So you would notice that if you are oily, it's able to kind of control that oil production and hence make you a little bit more dry. So if you are oily skin, you can introduce retinol into your routine, no problem. However, if you are dry skin, you have to be a little bit careful with the ingredients that you pair retinol with or how you use it, because essentially that could be a little bit more irritating and you could actually have more hard time into adapting into a retinol routine. And because it's able to increase the cell turnover rate, essentially your acne type, like life cycle, is able to be reduced as well. So essentially, if your acne takes, I don't know, 2 to 3 weeks for it to appear, and then it scars a little bit, and then essentially you'll see that that scar tissue is fading after 2 to 3 weeks time. Some people it takes longer. So retinol actually is able to speed up that process. So acne scarring is definitely reduced if you start using retinol, and also that life cycle of the acne is also reduced. What you are essentially doing is you are clogging less pores, and it's having less time to react and cause a bacterial type infectious acne on your skin. So you definitely do see improvements of acne control as well. So it's a great benefit. That's why it's so amazing to add it to your routine. So hopefully you're able to understand the benefits of the retinol, and you are now saying, yes, Sheila, I want to get starting on this retinol, but how do I start? The first thing that is very important is applying retinol at night only. So you never apply retinol in the morning, because it does make your skin more photosensitive, so that essentially means more sensitive towards light. So you wouldn't want to essentially put such an active ingredient and then go out to the sunlight. What you normally want to do in the morning is definitely use more antioxidant based serums or creams, and then use an SPF if you are especially going out. It doesn't matter the season of the year, you should always use an antioxidant serum and also an SPF in the morning. So those are the kind of protective ingredients that you should be applying in the morning, and at night it should be more of your active, more of your treatment, more of your active ingredients that you are using to treat or to repair your skin throughout the night. So that's why it's important to use retinol at night only. Essentially, if you're just starting off with retinol, what you want to do is you want to start off using it maximum 2 times a week. You have to give 3 and 4 days between usages. And then I'll say after 3-4 weeks, maybe increase the consistency to 3 times a week. So I'll say with retinol, again, it also depends on the concentration, right? So let's say you are starting off with a lower concentration, which is 0.3%. I would say that you could essentially, again, you always adapt to using retinol, even if it's at low concentration, 0.3%. It's 2 times a week, and then you increase it to 3 times a week. But if it's at low concentration at 0.3, you could practically be using it every night once your skin is adapted to it. If it's at 1% concentration, which personally think it's a little bit too irritating on the skin, and it does take a little bit long while to get to using 1% formula, 1% retinol. So let's say if you have a 1% retinol, again, what I would do is you definitely want to adapt into the routine of using it maybe once or twice a week. I'll say if you are more on the 0.3% category, you could essentially do cleanse, tone, retinol serum or cream at 0.3%. But if it's more of a 1% category, you essentially what you want to do is cleanse, tone, moisturize, then retinol. You're kind of using your moisturization in between as a cushion, so when you do apply your 1%, it's not going to get directly absorbed onto the skin. When you are starting essentially retinol into your routine, it's important to start at low concentration. That's what we discovered. So 0.3%, 0.5%, and only if your skin can handle it, and by all no means no requirement at all, then you can increase it to 1%. So hopefully that's how you will use it and the consistency of using it. That's something that I really wanted to talk to you about. Right, so again, this is a big no-no. So normally it's It's recommended to use creams, moisturizing creams, especially the creams that are humectants and more of a moisturizing category, such as ceramides, peptides, hyaluronic acid, sodium hyaluronate. These ingredients, or glycerin for example, or glycerol extracts, these ingredients are very good included in they are very good moisturizing factors, right? So again, we're a bit like diversing off the topic, but the best way of using moisturizers is always applying moisturizers on damp skin. Whereas with retinol, what you want to definitely avoid is not using it on damp skin. You want to use it on dry skin, and essentially dry, moisturized skin. So if you use it on damp skin, retinol is going to be absorbed into your skin very quickly, and that's going to be very irritating for you, so do not do that. Another important aspect is how to pair retinol and which ingredients to use it with and which ingredients to avoid. So the ingredients that you should definitely not use whilst you are using your retinol, this is at the same time, right? So you can practically use your benzoyl peroxide, your BHA, AHA in the morning, and then you use your retinol at night. So you don't want to use it in the same routine. So the ingredients that you have to avoid is acids. I'll say the only acid that potentially could be okay using with retinol is PHA, so that's polyhydroxy acid. There's a toner by Medicaid, which is the Press and Glow, that contains 5.5% PHA, which does say on the description as well that it's okay to be used with other actives such as retinol. So apart from a PHA, I would be very cautious of recommending anyone that has sensitivity, or recommending anyone essentially that could cause sensitivity on your face. Stay away from using acids on the same night. So do not apply it with BHA, AHA, benzoyl peroxide, L-ascorbic acid, vitamin C. These are kind of the ingredients that you should avoid using at the same time with retinol. For example, if you have a BHA or AHA serum that you want to use, you use that the nights that you are not using retinol. So that's why you have to be a little bit careful with how you pair your retinol. So essentially, you don't want to pair it with acids. And you also don't want to pair it with, I know retinol, you can use it with vitamin C, but it needs to be a stable form of vitamin C. So I personally would always stay away with using vitamin C in any forms alongside with retinol, unless it's in the same formulation. So how you want to do it then is essentially, as I said before, you use vitamin C in the morning, if it's especially an active vitamin C and potentially unstable, and use retinol at night. Or essentially, if you are not using AHA, BHA serum, then, and you don't want to use vitamin C in the morning, what you can do is, so you use vitamin C in one evening, and then the next evening you use retinol. So you can alternate like that as well. So that's how you would essentially pair retinol. Because retinol could be quite drying to the skin, it's very good for the retinol to be paired with ingredients such as peptides, ceramides, sodium hyaluronate, niacinamide, vitamin E. These kind of nourishing ingredients would be very well suited with retinol, because essentially you're kind of desensitizing the skin as you are using retinol. So it's very good to find a formulation that is able to contain these humectants, these nourishing forms of ingredients, and then use retinol as part of your protective and regenerative regime. Another important thing is essentially some people do not cleanse in the morning. I don't understand why. I think cleansing in the morning is essentially very important, because you're starting fresh, you're starting on a fresh canvas, especially if you have a nice hydrating cleanser that is able to smooth out the skin. Yeah, I think that's the correct word. So it's like smooths out the skin, removes any impurities, remove any excess product that you have left. Especially if you are using retinol, it's so important to cleanse the skin, because you don't want to have anything active left from the night before. And then essentially, if you don't cleanse and you put another antioxidant serum or a moisturizer, you're building up and it's making your skin a little bit more photosensitive. Now I want to mention about the eye area. Now the eye area is very sensitive and it's very delicate, right? Don't apply anything at 1% around the eye area. That is just going to be very drying. You will essentially damage the delicate skin area, delicate skin around the eye area, which I definitely don't want you to do. So if you are introducing retinol into the eye area, it has to be at low concentration. I'll say 0.2 to 0.3%, maximum 0.5%, but that's only if you buff it in with an eye cream. So essentially you put an eye cream that's quite nourishing, like an eye balm, and then essentially you can go with your retinol 0.5%, only and only on top of moisturized skin, never directly on dry skin, cleansed dry skin. To be on the safe side, I would always recommend eye creams that contain retinol, because then you know that it's tested in the laboratory for it to be essentially suitable for the delicate eye area. So that's what I would personally go for, products that are developed for eye area, so it's eye cream, eye balm that contains the retinol in lower concentrations. Okay, another important point to consider is, what are you using your retinol for? So this is totally about your skin type and your skin needs. I want you to realize why you are using this retinol. I don't want to say to you, yes, you have to use retinol because it's a great ingredient. You have to make sure that the formulation of retinol should be suited for your skin type and your skin need. Because retinol is such an ingredient that it's good for anti-aging, it's also good for hyperpigmentation, it's also good for acne control. Essentially, retinol is included. Just think of this ingredient that formulators essentially say, oh, okay, I'm gonna now make an anti-aging cream, so I'm going to be using retinol in my formulation. So they get the retinol and they pack it. They actually formulate it in a form that is suitable for anti-aging mature skin. And again, you have the form of using it with, and again, there are some formulators that say that I'm going to be using retinol as part of the hyperpigmentation treatment. So they'll get the ingredient and they'll put it alongside with licorice, vitamin C, like alpha-arbutin. They can mix it with ingredients that is essentially suitable for hyperpigmented skin. And again, there are some formulators, especially they want to use retinol as part of an acne treatment product. So they'll mix it with willow bark, they'll mix it with witch hazel, they'll mix it with kind of acne control ingredients and use it retinol in that form. So what I want you to do is essentially understand what's your skin type and what's your skin needs, and then choose a retinol product that is suitable for your skin. If you are using it for anti-aging, make sure the retinol is included in an anti-aging cream. If you are using it for acne control, make sure that the product is suitable to use for acne control. So this is what you don't want to do. What you don't want to do is use a retinol that is suitable for acne prone skin, but you don't have acne prone skin, and you're putting essentially lots of astringent and oil absorbing products just because it's got retinol. So you don't want to do that. And you also don't want to use retinol if you have acne prone skin, but it's essentially designed for anti-aging, so it's much more nourishing, much more hydrating, it's much more rich, but then you have got the risk of clogging your pores, and essentially it will react with your skin and produce more acne as well. So that's why you want to be quite careful, and when you are selecting the correct retinol for your skin type, it has to be according to your skin needs. Another one that I forgot to tell as part of the don't for the retinol is, do not use retinol if you are pregnant or if you are breastfeeding. So there's no specific, obviously, trial and error done on pregnant ladies in regards to the retinol usage. Obviously that will be very unethical and no one would test on pregnant ladies anyway. So retinol is definitely something that you should be avoiding if you are pregnant or lactating. So instead you can actually go for phytoretinol serum. So that's like Bacchitol. Bacchitol is a natural alternative for retinol. So it's not a vitamin A derivative as such. So it's not the pure retinol form. That's why it is safe to use. So you can find products if you still want to carry on with using some type of cell rejuvenating ingredient to treat with your hyperpigmentation or acne, for example. Bacchitol is a good alternative to use. Also, another ingredient that is suitable to use when you are pregnant is azelaic acid. So azelaic acid works really well for hyperpigmentation and also for acne and to treat acne as well. So azelaic acid or Bacchitol or combination of both of them would be essentially a good suitable alternative if you are looking to use vitamin A, but you can't use due to the fact that you are pregnant and you are breastfeeding. So that's something that you should definitely look into. Definitely subscribe to my channel because I'm going to do a part 2 of this retinol series, and that's going to be essentially covering all the products that would be suitable for specific skin types. So it will be for hyperpigmentation or for aging or for acne treatment. I will recommend you my top favorite retinol products that will be suitable for your specific skin type. So definitely subscribe if you want to know my approach when it comes to skin care formulation and product consistency and efficiency at the same time. So hopefully you have a really, really lovely day. Stay tuned and see you soon. Bye.